Have you been struggling with sleep lately due to difficulty in breathing? Is it something that's been strong and recurring? If this is the case, then you might be suffering from bronchitis. Bronchitis is a medical condition in which the bronchial tubes responsible for carrying air to the lungs get infected and swollen. When this happens, you will definitely have a bad cough with a lot of mucus and some cold symptoms such as chills or body aches. Knowing how to sleep with bronchitis can prove to be a Herculean task, especially if you don't know the steps to take. There are two types of bronchitis. They include acute and chronic bronchitis. Acute bronchitis is very common and mostly resolves on its own just within a few weeks. Chronic bronchitis returns or never disappears. This type is always caused by smoking. With both types, it's best to avoid things that irritate your lungs. When you smoke, you are further endangering your health as your lungs become more susceptible to infections. If you need help with calling it quits with smoking, talk with your doctor about what works best for you. Avoid chemical fumes, dust, smoke from people around you, and other things that can irritate your lungs. In the event that you can't stay away from these things, try wearing a mask. You can wear a mask if cold air causes coughing or shortness of breath for you. If the cough keeps you awake and you seriously desire to go back to sleep as soon as possible, you can start by trying out these steps. 1. Start getting enough rest. One of the symptoms of bronchitis is fatigue. Most times the infection and cough can cause severe fatigue. Studies show that sleep can strengthen the immune system and help recover from infections. Sleep helps the body create new tissues or repair damaged ones, restore energy and release important hormones. Use more pillows to lift your head when you want to sleep. This sleeping position can help with calming breathing and expelling mucus from the chest. 2. Drink enough fluid. Bronchitis is an infection of the lower respiratory tract of the airways and lungs. Doctors always recommend and advise people with respiratory infections to improve on their fluid intake. People with bronchitis get dehydrated due to high fluid loss caused by fever, shortness of breath, colds, vomiting and diarrhea. Dehydration can lead to dizziness, headaches, confusion, and more throat discomfort. 3. Use a humidifier. Good humidifiers usually increase the moisture level in the room by releasing moisture or steam that will be enough for breathing effectively. You should know that cold temperature and low humidity is associated with increased respiratory infections. Low humidity also irritates the nasal passages and throat, causing itching in the eyes and dry skin. Breathing warm and humid air can help loosen mucus and encourage drainage. The people that use humidifiers must ensure that the device is properly maintained and that the humidity level is monitored. A dirty humidifier is a breeding ground for fungus or bacteria. Also, excessive humidity can cause respiratory problems as well as allergies and asthma. 4. Stop smoking. Smoking is one of the leading causes of chronic bronchitis. Quitting smoking and avoiding passive smoking can improve a person's quality of life. Smoking affects the bronchi and the body's immunity against infection. Inhaling smoke can cause severe coughing if the person has bronchitis. 5. Follow a healthy diet. A healthy diet consists of fruits, vegetables, and whole grains as well as lean meat, poultry, beans, fish, eggs and beans. It also contains low-fat dairy products and reduces saturated and trans fat, salt, and cholesterol and added sugar. If you've enjoyed this video, click the subscribe button below and hit the notification bell so you'll know once we post a new video. Also drop a comment below so we can know your thoughts. Finally, don't forget to check the description below for more details and visit our site www.zimsleep.com for more awesome sleep content like this.